My name is Dr. Gary Magdesian. I'm a clinician here at the Veterinary Medical Teaching Hospital at UC Davis. I'm specialized in internal medicine and emergency critical care. And this is Peppy here, my assistant. Our goal today is to review auscultation of the equine heart, or in simple terms, how to listen to a horse's heart. I'm going to demonstrate that on Peppy and show you the landmarks and how to perform that. First of all, we'll start with reviewing a normal resting heart rate in horses. And that is, it ranges from 28 to 48 beats per minute. Every individual horse has its own normal, and so you should become familiar with what your own individual horse's resting heart rate is. Next is the equipment used to perform auscultation of the heart, and that is with a basic stethoscope. Third is to review the different heart sounds that horses' hearts make. The basic heart sounds are called S1 and S2, and those sound like a lub and dub when you're listening to the horse's heart. It's also normal to hear two additional heart sounds in horses. Those are called S3 and S4. They're usually not as loud in intensity, and normal horses can have anywhere from 2, the S1 and S2, or as many as 4, S1, S2, S3, and S4. Lastly, I'll be reviewing the valves that exist in a horse's heart. And those are the pulmonic, aortic, mitral valves, which are best heard on the left side, and finally the tricuspid valve, which is best ausculted on the right side. To keep things simple, though, the most important thing is to find the point where heart rate can be picked up easily. Usually that's on the left side. And the most important thing to listen for is that lub-dub sound. We'll start with reviewing the location of the different valves. The easiest to find is the location for the mitral valve, which is in the 5th intercostal or rib space, and that's found just above the level of the elbow or the point of the olecranon bone and just behind the triceps muscles. Moving forward one rib space is the aortic valve, and that's just slightly above and forward of the mitral valve location. And finally, the pulmonic valve is located one additional rib space forward and about equal to the level of the mitral valve. So it forms a triangle of PAM or PAM. It's important to note that the stethoscope head is placed under the triceps muscles, not directly on top of the triceps, because the musculature will muffle the heart sounds and make them difficult to hear. From a basic standpoint, the most important thing is to locate the loudest point of the heart so that you can get a reliable and consistent heart rate. As you begin to learn to auscult with more experience, you can focus in on the different valve points. But for beginners, it's most important just to find the loudest point of the heart rate. For purposes of illustration, I'm going to leave the landmarks in place as I auscult. And I'm going to start with the mitral. And what I'm hearing is a lub-dub, lub-dub, lub-dub. To auscult the aortic valve, I'm going to move my stethoscope head forward one rib space and just slightly dorsal or above the mitral level. And you'll notice that I'm pushing the stethoscope head underneath the musculature. Again, I'm hearing lub-dub, lub-dub, lub-dub. And finally, for the pulmonic valve, I'm going to move even further one rib space and lower the stethoscope head slightly. Again, I'm hearing lub-dub, lub-dub, lub-dub. Where the neck ties into the chest, you can see a visible slight deflection of the carotid, which is one of the major arteries coming off of the heart. And if you watch long enough, you'll see a very slight up and down motion in what we call the jugular furrow, this long trench that comes down the neck. Right where it ties in the chest, you can see a little up and down motion, which can also give you an indication of the pulse. Another important component of the cardiovascular exam is to evaluate the mucous membrane color and texture. In normal horses, it should be pale pink to pink, like it is in this mare, and it should be wet and slippery when you run your finger on the gums. And then another important parameter is to look at the capillary refill time, which is the amount of time it takes for the pink color to return after you blanch the mucous membranes. And how that's done is to press against the mucous membrane with your thumb, and the color should return in about 1 to 2 seconds. So again, I'm going to blanch the membrane, and the color should turn white, and it should return to pink within 1 to 2 seconds. On the right side, there's only one valve to listen to, and that's the tricuspid valve. That one is in the 3rd to 4th rib space or intercostal space. So that's very forward. Again, I'm going to have my stethoscope really far forward underneath the triceps musculature. And the level is above the elbow or the olecranon bone and below the point of the shoulder. So it's going to lie in that space really far forward underneath the triceps. Again, what I'm hearing is lub-dub, lub-dub, lub-dub. After a brief trot, her heart rate is increased to about 60 beats per minute. I'm hearing lub-dub, 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 lub-dub.